One of our big challenges in dentistry is we have people that come in that have a significant dysbiosis of the oral biofilm. Hi, I'm Doug Thompson from Bloomfield Hills, Michigan. I'm a general dentist, and I'm a general dentist that has a real keen awareness about how oral conditions affect systemic health. Part of that research or part of that understanding has taken me into the cardiovascular world, because what I didn't know, and I've learned recently, is that oral bacteria and oral conditions can significantly affect cardiovascular disease. And that was odd for me. In fact, we wrote a small contributing piece in a recent book edited by Dr. Mark Houston about the significance of gum disease in cardiovascular wellness. And one of the key components of cardiovascular disease and the oral connection can be looked at or learned about if you look at vascular biomarkers of disease. So we not only look at bacteria in the mouth and what bacteria are there, but we look at vascular biomarkers. And one of the things we'd like to know, because we know certain bacteria affects arterial stiffness, it affects HDL efflux, it affects nitric oxide production. One of the things we'd like to know is, could we measure those things? And so any measurable or any instrument that will allow us to measure and help educate the patient is going to be valuable to us. So whether it's a blood draw, whether it's Max Plus, whether it's some other tool or some other device that you would use in practice, if it lends to patient education, making better decisions for better overall longevity and vitality, that's a good thing. What a lot of dentists might not know about is that there's a molecule made in the blood vessel's wall called nitric oxide. And nitric oxide is a vasodilator. It's also made in the paranasal sinuses of the nose. We in our dentistry encourage patients to nasal breathe versus mouth breathe for nitric oxide production. Nitric oxide production is also produced by bacteria that live on the tongue, commensal bacteria. One of our big challenges in dentistry is we have people that come in that have a significant dysbiosis of the oral biofilm. And if they have a dysbiosis, that means the biofilm is not balanced. In order to balance that, we oftentimes have to use antimicrobials and things that might affect the commensal bacteria. So we need to know and measure the patient's ability to manufacture and utilize nitric oxide. And so I recently heard a lecture from Dr. Nathan Bryan, and it was eye-opening for me, because I didn't realize the significance of nitric oxide and the impact that we could have on helping somebody either restore nitric oxide balance or to restore functionality of nitric oxide and what it's supposed to do. So that's new for us, it's exciting for us, but there's a lot of opportunity for dentists to get more involved in learning about this unique molecule and how to best preserve it for somebody in the mouth, through the mouth. Many people ask me, what do I think would have the biggest impact on the medical-dental collaboration and really push people to a different state of overall health? The one thing that I think could really move it is if dental offices and dental teams had some increased elemental small even awareness about how the oral cavity can have a tremendous impact on systemic health. And if we had physicians and dentists collaborating with that like-minded goal and that like-minded message, it would be amazing.